Hello, today let's discuss the difference between IVF, ICSI and IMSI. So all the three techniques are basically fertilization techniques. Now what happens in an IVF cycle? The woman is stimulated to produce multiple eggs, and these follicles which contain eggs, they are aspirated. Once the follicular aspiration is done, these eggs are separated out. So the eggs which are collected from the follicles, these are placed within petri dishes. The sperm sample is then checked with respect to the quantity of the sperm, that is the sperm count, with respect to the quality, which includes both motility and morphology. If there's a good semen sample, then we can just proceed with IVF as the fertilization technique, where the prepared semen sample is just put around the egg and this is left in the petri dish to culture. So there will be a natural selection of the sperm among all that is left around the egg, and the fertilization gets completed within 18 hours. Now in case of abnormal semen parameters, with either with respect to low counts or low motility, then the fertilization technique of choice would be ICSI, which stands for intracytoplasmic sperm injection. So here the eggs are denuded, where we separate the mature and the immature eggs. The mature eggs are then held with a holding pipette under the ICSI manipulator, and the semen sample that is prepared is then brought into the view, where we select the sperm. Each sperm is then selected and then introduced into the egg by a technique of injection. So this process is called ICSI, and if the patient has about 10 to 15 eggs, each egg is then injected with one sperm, and then these fertilized eggs are then left in the culture dish for further growth. Now coming to IMSI. Now IMSI is a modification of the ICSI process. So here what happens is, we are morphologically selecting a sperm for ICSI. So in patients with severe teratospermia, where they have very poor morphology, they may have abnormal head, abnormal neck region, abnormal tail region. So here we can see very small defects in the head also. So this helps for patients where they also face recurrent implantation failure or recurrent pregnancy loss, or in previous cases of failed ICSI. So IMSI helps us in better selection of morphologically good quality sperms to improve the IVF outcome.